Hello, am I audible?
Yes, ma'am, you are audible.
Yes, madam.
Sorry, ma'am, I couldn't connect from the laptop. Actually, ये सब arrangement मैंने laptop पे की थी. So
जी.
I'll connect from the mobile only now. The
Okay.
only thing is I'll have to do the slide share then because my PPT, है ना? That is the only thing because since my live music is there, no, I had arranged everything on the laptop, but for some reason this it is not getting connected.
Ma'am, you want some more time?
No, I want the facility to इसमें slide share हो सकता है ना?
हाँ, slide share हो जाएगा.
Okay. Then what is the operation for that? 1 minute.
If you need time, then we
No, I don't need time, ma'am. I'm perfectly ready. The
Okay.
thing is, I'll have to do the slide share. It is in my mail only. The slide. My
Okay.
PPT is in my mail only. I
Okay.
just don't know the operation. What I'm supposed to do
Okay.
for that
Okay.
slide. 1 minute. Can anyone tell me how to do slide share? 1 minute. Huh?
मैडम का नहीं आ रहे थे. एडमिट करो. हाँ. नीता मैडम तो नहीं दिख रहे. नीता मैम का आई नहीं था. हाँ. Good morning, all the participants. Everything is ready to start the webinar, but we are waiting for our chief guest, our Pro Vice Chancellor, Madam Professor Meeta Kotecha. Madam is soon joining, so as soon as Madam joins, we'll start our webinar. So kindly bear with us for a few minutes. Thank you. Welcome, Professor Meeta Kotecha Madam, our beloved and respected Pro Vice Chancellor Madam. She has joined, for whom we were waiting, and we are starting now the webinar. I request Seema Madam not to share right now the slides. Our banner and Dhanvantari Stavana is there. After that, we request you to share, Madam. Seema Mere Madam. Thank you, Madam.
A very good morning to our Chief Guest, Dr. Meeta Kotecha Ma'am, our HOD Ma'am, Dr. Professor K. Bharti Ma'am, all the respected teachers, our speakers, Dr. Seema Mere Ma'am and Dr. Baljot Kaur Ma'am, and I also welcome all our viewers from Facebook Live and YouTube Live. I, Dr. Rosina Sheikh, am a second-year scholar, welcomes you all on behalf of Department of Prasutitantra and Striroga, National Institute of Ayurveda, in webinar on women's health through Ayurveda. As it is our tradition to seek blessings from God before any new beginning, I would invite Dr. Shweta for Dhanvantari Vandana.
नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोकैर्जरारोग्भयमृत्युनाशं धातारमीशं विविधौषधीनां च व्योमवातावनिवारिवह्निं पञ्चं प्रपञ्चात्मकदेहभाजं सन्तापसम्पातजराज्वरान्तं नमामि धन्वन्तरिमादिदेवं नवीननीलमुदकान्तिकान्तं शान्तं हरैर्द्वादशमाख्यमूर्तिं पूर्तिं शतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवं नमामि धन्वन्तरिमादिदेवं. Thank you, ma'am.
Thank you, Dr. Shweta, for this melodious start. Now I would request Dr. K. Bharti Ma'am, Professor and HOD, Department of Prasutitantra and Striroga, NIA Jaipur, for her welcome address.
Thank you, Dr. Rosina. There is some disturbance. IT people, kindly mute all the participants. I request to mute their mic. Thank you, Dr. Rosina. अभी ठीक है. So, I, Dr. Bharti, welcome you all the participants for the one-day online webinar. organized by Department of Prasutitantra and Striroga, National Institute of Ayurveda, Demotiv University, Jaipur. And on the occasion of Ayurveda Day 2022, the department is taken up to organize this program, and we have chalked the program, which is very interesting. The ragas and music therapy in pregnancy. It's quite interesting, I believe, for everyone. And another burning issue is the endometriosis. The other speaker, second speaker, is going to talk on that. So, with a fond hope of sharing the knowledge of our learned experts who joined us today's webinar, I welcome you all for the today's webinar, Women's Healthcare through Ayurveda. So, I welcome our beloved, most respected Professor Meeta Kotecha Madam and Dr. Seema Mehra Madam and Dr. Baljot Kaur, and all the faculty of our department and NIA who have joined live on the YouTube, Facebook, and who are sitting with us in our museum. So this is quite interesting webinar. So don't miss for entire time. Please hang on to our online this sessions. I'm sure you'll enrich with the knowledge, and I thank the speakers also for giving their time out of their busy schedule. So with this, I'm handing over the session to Dr. Rosina.
Thank you so much, ma'am. Now I would request Dr. Meeta Kotecha ma'am, Pro-Vice Chancellor, National Institute of Ayurveda, Jaipur, to deliver her presidential address.
सभी को मेरा नमस्कार। आज बहुत अच्छा लग रहा है कि आयुर्वेद डे के संदर्भ में आपने ये सेमिनार रखा है, और ये वेबिनार बहुत यूज़फुल होगा क्योंकि लेडीज़ हैं अपनी हेल्थ के प्रति बहुत ही लापरवाह होती हैं। फैमिली में सबकी हेल्थ का ध्यान रखती है पर खुद के लिए कभी समय नहीं निकालती और ध्यान नहीं रखती हैं, इसलिए बहुत इम्पोर्टेंट है। और आज के दिन में ये बहुत ज़रूरी हो गया कि विमेन हेल्थ पे ध्यान दिया जाए, क्योंकि आज की जो लेडी है उसके पास बहुत सारे काम है, मल्टीटास्किंग काम करने पड़ते हैं, उनको बहुत सारी चीज़ें संभालनी पड़ती हैं, और अगर उसकी हेल्थ अच्छी रहेगी तो पूरी फैमिली की हेल्थ भी अच्छी रहेगी। तो विमेन हेल्थ के लिए जागरूकता, अवेयरनेस बहुत ज़रूरी है, और उसके लिए जो आपने ये वेबिनार रखा है बहुत अच्छा टॉपिक भी रखा है। और सीमा जी का मैं टॉपिक अभी देख रही थी कि रागा पे म्यूज़िक थेरेपी, रियली म्यूज़िक थेरेपी बहुत ही इफ़ेक्टिव है। और संगीत ऐसी चीज़ है कि अपने आप में एक मेडिटेशन का काम करती है, और बहुत सारे रोगों में उससे फ़ायदा दिला सकते हैं हम, और सबसे ज़्यादा मन पे प्रभाव उसका बहुत है। तो मन की प्रसन्नता के साथ सीधा जुड़ा हुआ है म्यूज़िक। और बहुत अच्छे टॉपिक और बहुत अच्छे स्पीकर्स आपने चुने हैं, तो इसलिए मैं प्रसूति विभाग तंत्र पूरे को बहुत बहुत इसके लिए साधुवाद देती हूँ। प्रोफेसर भारती जी को भी उसके लिए धन्यवाद देती हूँ। और ये वेबिनार बहुत अच्छा सफल रहे, सबको इससे बहुत ज्ञान मिले और बहुत कुछ नई चीज़ें सीखने को मिलेगी, ऐसा विश्वास है, और उसके लिए मैं शुभकामना देती हूँ। नमस्कार, बहुत बहुत धन्यवाद।
Thank you so much, ma'am, for your valuable words. So without any further delay, we will be moving on towards our first session. For this session, I would like to invite our first speaker of today's webinar, Dr. Seema Mehra ma'am. Dr. Seema Mehra ma'am is currently working as Professor and HOD of Gynec Department at Dr. G.D. Paul Foundation's YMT Ayurvedic Medical College and Hospital at Kharghar, Navi Mumbai. She has been appointed as member of the Research Advisory Committee in Science Ayurvedic Mahavidyalaya, Mumbai for the PhD section. Ma'am have organized various camps and she has delivered her important time and duty in those camps. Ma'am is currently giving Ayurvedic treatment for mother and child safety in pregnancy, Ayurvedic Garbhini Paricharya under Supraja Sanskar. Ma'am has also taken various lectures and especially she has taken lecture in advanced PhD workshop conducted by the MUHS in July and August 2021. So ma'am, I would request to please start the lecture.
Thank you very much, ma'am. I hope there is no technical issue now. So thank you once again, the organizers of National Institute of Ayurveda, to be University Jaipur. Our chief patron, Sir Respected Shri Sonowal Sir, Honorable Cabinet Minister of Ayush. Then our patron, Vaidya Respected Rajesh Kotecha Sir, Secretary Minister of Ayush, Government of India. Our organizing chairman, respected Professor Sanjeev Sharma, Vice Chancellor, and now Deepa Madam, Pro Vice Chief, Pro Yes, ma'am. Thank you for your encouraging words. And without, as I said, without any further delay, now I'll start my lecture. Everyone is curious what is music in pregnancy, and we all know how and how basically how it is related to Ayurveda. That is the main thing, because we have taken this. The organizers have taken this, and we are interested in the program of Har Ghar Ayurveda, Har Ghar Har Din Ayurveda. So how does Ayurveda and Sangeet come together? What is the connection? We will see that first, and then we will go on to see which raga is used to be in which month. जैसे हम हमारे गर्भ संस्कार सेशन करते हैं इधर, so that time what I do is music and mantra is in under me. So what I do is I tell mantras also, but उसका ये अलग है, and that topic is different. But music in pregnancy is another topic, and I will start the slide share. 1 minute. Huh? Please be patient.
I will.
Ma'am, I would request you to please unmute your mic once again, please. Ma'am, please unmute yourself. Dr. Seema, ma'am, I would request you to please unmute your mic.
Am I audible, ma'am?
Yes, ma'am, you're audible.
And everyone can see my slides, PPT?
Yes, ma'am, your slides are visible.
Shall I start then? No issue, no?
Yes, ma'am.
Okay. Thank you very much once again. And this is what you are seeing is my PPT on effects of ragas in pregnancy. So I have already introduced, my anchor has introduced. So this is basically what is music therapy. So we all know the pleasant effects of listening to melodious and soothing music. Music used in the right way, it can be healing also. Because of calming and soothing effects, music can be beneficial to the fetus. And studies have been found that music can enhance the brain development in the fetus. To begin with, I will just tell you one thing, that music doesn't mean only only classical music. We don't intend only classical music. There are other ways of music therapy also, which are Western music, Mozart, Beatles. जिसको जो अच्छा लगता है वो उसको सुने. But the calming and soothing effects are important. Since we are हमारा भारतीय शास्त्र, भारतीय परंपरा जो है, we give more importance and we learn also music many times. So we are familiar with classical music, Indian. That is why I'm talking about ragas in pregnancy. Okay. So in the beginning only, as I said, that what is the connection between Garba Sangeet and Ayurveda. So in the beginning only, we know that there are 4 types of Vedas basically. So Ayurveda is a Upaved of Atharva Ved, and Samaved जो है, that is full of all music, dance, all the kalas which we have learned from childhood. So वो जो संगीत है, गर्भ संगीत, that is a part of this Samaved. And Samaved में एक शारंगधर करके है, but this शारंगधर is not the one whom we are familiar with in Rasa Shastra department. शारंगधर is different from शारंगदेव इसका नाम है, and उनका एक संगीत रत्नाकर करके ग्रंथ है, उसमें सब ये रेफरेंसेस आए हैं. Regarding this photo which you are seeing here, it is a mythological character. ऐसे हमारे भगवान धन्वंतरी है, वैसे ये लॉर्ड तुम्बरू है, उनका नाम तुम्बरू है, which is a name is also very different. तो उनका एक्चुअली ऐसा है कि it is a body of, it is a नारद मुनि का अवतार है, and he is as a face, मतलब जैसे गणपति बप्पा का है कि the head is of the elephant and the bodies of human. So in his case it is वराह है, and उन्होंने वो, it is a mythological character, उन्होंने स्वरामृत करके ग्रंथ लिखा था. जैसे वेदों का इतिहास हिस्टिकल है, वैसे इसका भी है. और उस स्वरामृत में जो है, उन्होंने सारा पूरा त्रिदोष कनेक्शन बताया है कि किसका आवाज कैसे है. तो अगर वाता दोष का प्राधान्य है तो आवाज उसका ऐसा है, एंड पित्त है तो ऐसा है, द्वंद्व जो है तो ऐसा होगा. एंड हाउ सप्तक स्वर and even the navarasas, how all they are connected, and why the sangeet has effect. See, Garba Sangeet itself is not going to treat, but it is a very enhancing factor in our Garbhini Paricharya. So another some references which are given in Charirasthan, जैसे गर्भ संस्कार हाँ हमारा actually मूल शब्द है ही नहीं. What we are doing is गर्भाधान संस्कार, पुत्रीय, that पुत्रेष्टि यज्ञ, उसमें जब वर्णन किया है वो है गर्भिणी परिचर्या है. These are references, these are not direct गर्भ संस्कार ऐसा शब्द नहीं है, लेकिन श्रेयसी प्रजा चरक ने बताया है, and that is what is our हेतु, अनुपघाताय परिपूर्णत्वाय and all that. So उसमें म्यूजिक कैसे आता है? So in some cases, even in the references they have given, for example, I will give, if anyone is interested, I will give the references afterwards. सोमगुरुत में बताया है कि जिसको अगर गाना अच्छा, मतलब अगर बच्चा चाहिए तो वो लिया, उसका बेनिफिट अच्छा रहेगा, बल वर्ण ऊर्जा स्वर उससे अच्छा है. So this is the references which we have. Swaramrut is a grantha which is available now. It is originated from Samaveda, supposed to be written by a mythological character. Tumbaru is a god of music, so उनको नमन करके मैं ये बताती हूँ आपको. So this is a shloka from that book Swaramrut, and उसमें ये description है. Why I am going to this is, first is we have to find out the Ayurveda connect. There are so many Garbha Sanskar classes which advocate music therapy in pregnancy. Typical should be listened by, heard by the Garbhini. Even in so many centers, they give some devices to be put on the abdomen, and they give earphones and tell the Garbhinis to sit in front of them and listen to that particular music. So उसका और जो गर्भ संगीत बोलते हैं उसको, उसका जो बेस है वो सब ये है. आयुर्वेदा हैज दिस बेस. सो उसमें क्या लिखा है? उच्चस्तरो ध्वनि रुक्षो विज्ञेयो वातज बुधैहि गंभीरो घनशीलश्च ज्ञातव्यः पफोज ध्वनिः स्निग्धस्य सुकुमारस्य मधुरः कफोज ध्वनिः त्रयाणां गुणसंयुक्तो विज्ञेयः सन्निपातजः. As you can see the description, उच्चस्तरो, some people they all talk in a high pitch. Even if you have to talk something normal, then also they will, उनका पिच जरा हाई रहता है, हम बोलते हैं अरे थोड़ा धीरे बोल, इतना ये कर रहा है. So that is उच्चस्तरीय ध्वनि, वातज दोष है उसमें प्राधान्य. Then there is गंभीरो घनशीलश्च. Just some voices are deep, you feel confident immediately after hearing that voice कि नहीं ये बंदा कुछ काम का लगता है. The confidence जो है उन आवाजों में, वो पित्त का ये है, because पित्त ऊर्जा, you all know that. This connects very much in Ayurveda. And snigdhasya sukumarasya madhuraha kafoja dhvanihi means there are some very buttery sweet voices. The biggest examples I can give is our गान सम्राज्ञी the late लता मंगेशकर. उनका जो वॉइस था दैट इज टिपिकल कफ का उदाहरण. उसके बाद फिर ऐसे ही वॉइसेस जो आए, श्रेया घोषाल, अलका याग्निक, सो मेनी पीपल आउटसाइड द बॉलीवुड इंडस्ट्री ऑल्सो. सो ये जो आवाजें हैं ये एकदम मधुर है, मतलब कर्ण मधुर जिसे बोलते हैं ना. सो दैट इज कफ प्राधान्य. स्निग्धस्य, देन गंभीरो घनशीलस्य बिगेस्ट एग्जांपल इज ऑफ द लेजेंडरी एक्टर अमिताभ बच्चन जी. उनका जो वॉइस है इट इज अ बैरिटोन है ना, रिच वॉइस है एकदम. So the moment you hear, you feel confident. कि अरे ये surprisingly, you know the story that he was rejected by the All India Radio when he came before becoming an actor. But that is another part. That just as a interesting information I talked about it. But Gambhiro Ghanashilasya, you will find such voices everywhere if you listen with that ear, And Uchchastara Dhvani, it is a little rough voice. Sometimes we like it also. Like for biggest example, again I will give of the film industry because those songs are most popular, and that is the voice of Anu Malik. So you must have heard these voices. Aati kya, lift teri band hai, kaise mein bataun, dil raza, whatever those songs. So though that voice or the other voices, which is even it is melodious, it is a little rough. Another example is Ila Arun. So these are the voices which are having kapha, pitta and Vata dosh pradhanya, and this reference is given in Samaved. This reference is not from Ayurveda. So other songs or other references are also there in the Grantha, but then again that will be one PPT. So I will just push आगे जाती हूँ मैं. So then what is classical Indian music? Indian classical music consists of various ragas. Music has a great impact on the mind, body, and sometimes the soul too, in all the living beings on earth. It is said that music and singing are God's way of communicating with us. You all know that the पहला जो हम बहुत बार ऐसे देखते हैं कि the baby, before even saying the first word, the baby starts singing. In many houses, in many homes, that the people who are classical singers, even 7 and 8 months baby or 11 months baby also, they will put videos. Nowadays, thanks to COVID, now everyone is online. There are so many, even we are online because of that only. So, so many people are uploading their child's singing. So what happens is it goes in the subconscious mind. And research has shown that if the Garbhini hears this typical music, after birth also till 4 months, the baby can remember what he has heard in the pregnant state. So calm and soothing music releases stress and anxiety. And so since ages, we sing a lullaby or a lori to a baby, put any baby to sleep. So as I always say कि गर्भ संस्कार हो, गर्भ संगीत हो या कुछ भी हो, एक्चुअली ये इतने हमारे परंपरा में बैठ गए थे ना. जैसे टुडे वी हैव टू अगेन इम्प्लीमेंट हर घर हर दिन आयुर्वेद, but there was a time when Ayurveda was the science, and that is why all these things came अपने आप. We didn't have to think कि अगर मुझे सर्दी हो गई तो मुझे सूंठ डाल के दूध पीना है, अगर मुझे कुछ जख्म हो गई तो मुझे हल्दी लगाना है, ऐसे. So these things, singing a lori to your child, that is so natural that it was there in our हमारे जहन में था वो. And what we are doing is we are doing research, looking for things which were already there, and we are presenting it again. So lori या lullaby कुछ भी हो, it is again impact of music. So this is our classical Indian music, which as we know. Music of different kinds and genres, but all music is basically soul satisfying. In this, I will like to add that all music is not acceptable at that time. In music therapy, we have to go for mood elevation theory is there. इसमें क्या है कि जैसे आयुर्वेदा में समाना की वृद्धि होती है, वैसे if you note, if music which appeals to you is the one in what mood you are that time. Suppose every time you don't like happy music, if you have observed, every time agar happy music लगाओगे dan, then people get irritated also. So why is that? Because उनका मूड अलग है और जो सुन रहा है उनका मूड अलग है. बहुत बार हम देखते हैं कि किसी पार्टी में जाके बुढ़े बुजुर्ग जाके वो बंद करते हैं या कंप्लेंट करते हैं वॉचमैन को कि ये कितना शोर मचा रहे हैं, एंड दोज पीपल आर एंजॉयिंग दैट म्यूजिक. सो द थिंग इज दैट जो मूड अपना होता है उस मूड को वो इट कनेक्ट्स टू दैट. And biggest example, patients of depression. When we start treating patients of depression with music, the first thing those people say ki, madam, we don't want this, we want this. So there are 3 stages. First is we have to tell them, the sad ragas like Todi. Then there are other ragas which are very, कम इसके हैं. हिंडोल भी थोड़ा कम एनर्जेटिक है. ये जैसे यमन है, यमन इज क्वाइट एनर्जेटिक. आई विल कम टू द डिटेल्स आफ्टरवर्ड्स. बट कहने की बात यह है कि what mood you are in is very important when you listen to the music. So first you have to counsel the patient. Don't just make the गर्भिणी sit and tell her कि ये तुझे सुनना है और बस बात खत्म हो गई. ऐसा नहीं है. You have to select which month is going on, what is her mood now, and that according to that you have to tell the ragas. So what we are going to see today is the healing effects of Indian classical music and some particular ragas which are there in pregnancy. You all can see that music relaxes. The effects of the womb. Now many times in Garba Sanskar also, or in Garbhini, counseling of the ANC. Nowadays even MGM, the big hospitals like Fortis, and they have a center called Garba Sanskar या सुरक्षित मातृत्व, ऐसा कुछ भी रहता है जिसमें योगा, मेडिटेशन, they advocate those things. And basically सबको हम क्या बोलते हैं, अभी वो गर्भिणी है उसको तकलीफ मत दे दो. वो जो स्ट्रेस है, दैट इज नॉट ओनली अबाउट फिजिकल स्ट्रेस, इट इज अबाउट मेंटल स्ट्रेस ऑल्सो. एंड द वूम्ब इज रिलेटिव ए क्वाइट प्लेस. वो शांत एरिया है जो वूम्ब है. द बेबी इज इन अ वेरी क्वाइट एंड रिलैक्सिंग प्लेस, एंड इट रजिस्टर्स साउंड्स अराउंड टिल 50 to 60 decibels. So normal conversation when you're talking to a गर्भिणी, please remember now in future, ऐसा कभी हम सोचते नहीं है, लेकिन जब ये अभी इसके बाद, I hope this goes in your everybody's, they will counsel the husbands of their patients, that when you talk softly. Even if nowadays it's not very lucrative to sit at home. Every Garbhini can't sit at home immediately. So she goes on a maternity leave on 7th month or 8th month. तब तक तो वो she's surrounded with all her colleagues and all. So the thing is that the patients or the people in her office also should be aware that she is pregnant and try to talk softly with her. अपने आप the moment you start talking softly, आपका ये भी कम हो जाता है. Even if you are in anger, you must have noticed it. हम जब एंग्री होते हैं then और एक्साइटेड होते हैं तब हम शाउट करते हैं. लेकिन अगर हमने वो कंट्रोल किया कि नो, आई हैव डिसाइडेड दैट आई एम गोइंग टू टॉक सॉफ्टली ओनली, देन अपने आप वो एंगर, वो टेम्पर, वो एनर्जी कम होती है. सो दैट इज द होल आइडिया. नॉर्मल कॉन्वर्सेशन करो गर्भिणी के साथ. द फीटस डेवलप्स ईयर्स इन द 3rd week of gestation, but they don't become functional till the week 16. While we know that the fetus can actively listen by week 24, ultrasounds reveal that the fetus can hear and respond to sound at week 16. इसमें एक ऐड कर सकती हूँ मैं कि our ex-Vice Chancellor of Mumbai, Dr. Snehalata Deshmukh ma'am, she has done great work in Garba Sanskar, and she has many CDs also. So what she had done that time in 93 जो riots हो गए थे बम्बई में, तो उन्होंने रिकॉर्डिंग किया था. जो साउंड्स जो आए थे उसका क्या परिणाम हुआ on the babies which were born. So many of them had ear defects, and that is her research paper. If anyone is interested, I can give you the link afterwards. So this is very true that the baby can hear. That is all the base, and not only hear, it can it can enhance the feelings. It is sensitive to what you say, and that is why Garba Sanskar and Garba Sangeet is important. This is the connection you can see. So what are the benefits? High stress levels in expectant mothers can have negative effects on the fetal development. You all know that अगर किसी पूरी कोई सुनता है, the patient becomes hyper and she starts contractions and she might go in premature labor. So ये जो मन शांति के जो सब साधन है उसके पास, वो हम उसको दे सकते हैं. Music is one part of it. Music and singing has a soothing effect on the expecting mother and the unborn baby, and contributes to a healthy and a happy baby later in life. प्रीनेटल बॉन्डिंग अच्छा होता है. वी टेल द पेशेंट टू टॉक टू योर बेबी, गर्भ संवाद जिसे बोलते हैं. Music is also important part of prenatal bonding. Listening to a relaxing song or singing lullabies sends calming chemicals throughout the body into the placenta, facilitating the bonding and the relaxation. So, listening to all kinds of music encourages early brain development in the fetus because music facilitates neuron connections in the brain. Listening and experiencing music stimulates the fetus brain and assists with the growth of the brain structures. New studies even suggest that baby remember the music they listen to in the womb for up to 4 months after being born. So, listening to music while you are pregnant is definitely a good idea for both the mom and the baby. So now we will come to the ragas in pregnancy. We will start with the second month because generally what happens, patient comes to you and most of the times in Ayurveda hospitals, patient comes for infertility treatment. When they conceive, they are already happy. Most of the times I'm telling you. So after that, first month goes like that only, UPT for investigations and all. So generally we advise the Garba enrollment right from the first trimester, second month. This is the period when differentiation of the tissues and formation occurs. It is predominantly a Vata Kapha Dosha dominated period with the involvement of the Rasa Dhatu as the principal. So basic raga used for second month is Miyaki Chodi or only Chodi also you can use. इसका सब demonstration आपको कहने वाली हूँ. Please bear with me. Then the third month, that is Arohi Hindol. The changes occurring in this period are organization and reorganization of the cells into a sphere and later into various organs in their seed form, which are on development will grow into complete body parts. Fourth and fifth month, this part of gestation life is very much important, and as it makes the psychological part of the fetus active, organs become more differentiated and the life starts showing its signs. This is predominantly a kapha dominated period where pitta also becomes active. Hence, the basic raga used is Madhmatsarang. The changes are development of the body parts and they start showing not only the contours but the life also being observed actively. Rakta and Mausa Dhatu become more active now, and the basic raga for this month is Ahir Bhairav. 6 and 7 month. This corresponds to the tissues, tendons, skin, and complexion. This gestation period is dominated by Pitta dosha, along with little activity of Kapha and Vata dosha. Basic raga used for 6 months is Madhmat Sarang. Madhmat Sarang, I'll just tell you one to make it interesting. ये शायद थोड़ा boring होता होगा आपको. Madhmat Sarang is a rag which is just very close to even Miya Mallar. तो अभी जो ऋतु हो गई मतलब actually this is October, still we are facing the rains, at least in Mumbai. So मिया मल्लार का जो है उसका ये थोड़ा सा नजदीक जाता है, and उसका अगर anyone Bollywood fans will remember that song from Chashme Buddu. I remember the whole song. I love them also. So I'll just tell you one piece so it will get a little interesting. कहाँ से आए बदरा वो गुल जाए कजरा कहाँ से आए बदरा oh. This is Madhmat Sarang. Then the Mausa Dhatu becomes more dominant. The bones and the Majja Dhatu start the activity. The later part of this period shows complete development of the body. At this point, the baby becomes a viable fetus. We all know the meaning, what is viable fetus, how significant it is. The basic raga of the 7th month is Komal Rishabh Asavari. अभी ये कोमल एंड तीव्र जो है वो दे आर द हाई एनर्जी एंड लो एनर्जी. सिंपल. One more thing I wanted to add is that after listening to this, you might feel, that this is just for जिन्होंने शास्त्रीय संगीत पढ़ा है and they have given exams, जिसको ज़्यादा गाना अच्छा लगता है, अच्छा आता है, वही लोग कर सकते हैं. ऐसा नहीं है. You can learn some instrument. I learned a little harmonium. That is why I will play some ragas in harmonium. But you can have a simple Casio and you can learn on that. And music therapy is not only for the people who sing. It is for people who love music. Simple. So ऐसा कुछ नहीं है. I have done a music therapy course, but I haven't any exams of शास्त्रीय संगीत, ऐसे ही मुझे म्यूजिक पसंद है, थोड़ा बहुत गाती हूँ, इसलिए मैंने वो कोर्स किया. So what I want to tell you is, even if you are not a singer yourself, some people are bathroom singers, but if you have interest and if you are conducting some Garba Sanskar classes, what you can do is you can take these ragas, you can search on YouTube or Google, and जो जो राग उसको मैच होता है वो म्यूजिक आप सुना सकते हैं. ठीक है. So the main thing is, I especially want to encourage our all जो स्नातक है आयुर्वेदा के, don't think that हमारे लिए see the sky is the limit. Everything is there in आयुर्वेदा. हमारा साइंस ही इतना ग्रेट था और है और रहेगा, वो शाश्वत है. तो अगर ये हमारे पास है तो वो क्यों नहीं दें हम हमारे पेशेंट्स को. दैट इज द होल आइडिया. यू कैन जस्ट टेक दिस रागास फ्रॉम हियर एंड आप सुना सकते हैं अपने पेशेंट्स को. We have also this is about from where I have learnt my music therapy course. पंडित शशांक कट्टी सर के पास मैंने किया. इंस्टीट्यूट है अंधेरी, and they have composed some different formations, and they had done some research. Sir himself had done some research in KM hospital, and they noticed that premature जो born होते हैं न्यूनेट्स, अगर उनको टिपिकल म्यूजिक सुनाया तो उनका ग्रोथ ज्यादा अच्छे तरह से होता है. 8th and 9th month, this part of gestation life is very vulnerable and unstable, because the ojas or the life force becomes unstable in this period. It is dominated by the vata and the kapha doshas. The basic raga used for the 8th month is rag Bairagi Bhairav. The final lap of pregnancy is the complete development of the fetus. The finer things in the development do take place, and a lot of care needs to be taken during this period. So this is a little about कहाँ से मैंने जहाँ कोर्स किया. So सुर संजीवन करके उनका ये it is for गर्भिणीज only, and I try to use my best. More than the CDs, I like to play live music. So this is just for your information. All the dhatus are developed in this period. Vata dosha is very active. It is the apan vayu which is responsible for the easy delivery of the baby. It is achieved by properly nourishing the neuromuscular system of the mother, and the basic raga used for that apan vayu is Jonpuri. The music therapy Ankur for each month is specially designed for the betterness of the specific growth of the fetus in that period. It can be safely said that listening to these ragas has special benefits in stress-related disorders like thyroid disorders, hypertension, diabetes, asthma, and so on and so forth. I would like to note one more thing, that music therapy is not only for the pregnant ladies, it is for others also. For example, for diabetic patients, the Rag Puriya Dhanashri is advised, and this research has been done by my guru, not by me. I am just doing it for Garba Sanskar and my 10 ragas for the 10 months. So these are the details if anybody wants. Yes, and one reference I should mention, Dr. Maithili Thirumalachari, Director of the Music Therapy Department, Apollo Hospitals, Chennai. She has done this research way back in 2009, and they had discovered that how the babies respond to music and how the health and the mother and the baby is secured by music. Another big reference is Shankar Mahadevan's Music Academy, Music for the Unborn. These are some references, and this is my contact information. This is my certificate from Surya Sanjeevani, and this is listening to music pregnancy importance. Of course, the photo here I have given, since what happens is, nowadays youngster log jo hai, who come for ANCs, we have to tell them that you don't wear tight jeans, don't wear tight leggings. You get maternity leggings and all, in the shops. So that is the reason why I put this photo. But I will not advise anybody to, dance like this. But listening to music, of course, choose the music which makes you happy and relaxed. I am repeating myself that there are n number of ragas. आपको जो अच्छा लगता है पहले आप सुनो, then you can treat the patient. Treat म्हणण्यापेक्षा in Garba Sanskar we can, it is a holistic treatment. And जैसा सब बोलते हैं ना कि all the rivers go ultimately to the sea. वैसे हर whatever holistic science which we are using, music हो, dance हो, रेकी हो, या even Garba Sanskar yoga and meditation, everything. The whole idea is a healthy mother and a healthy child. So here my information is over. Thank you. And now I will play some ragas, which I will tell you which raga you can play for the Garbhini. So just bear with me. If you can tell me whether you can hear me or not. Okay. So first is Yaman, second is Indol, and third is Madhuvanti. These are some ragas which I will play now. Again, I am repeating myself that you don't have to be a Sangeet person to know this. This you can learn on your own, not on your own, but you can do that course which I have done. So 1 minute. So this is what I'm going to play now is Rag Yaman. Yaman is very favorite of everyone. They can hear, no? Yeah. इट इज़ अ फेवरेट रागा ऑफ एवरीवन. हैप्पी म्यूजिक है. अगर पुराने गानों का कोई शौकीन है तो उनके लिए एग्जाम्पल है चंदन सा बदन, जब दीप जले आना एंड ऑल दैट. एंड फॉर द न्यू पीपल, न्यू जनरेशन मीन्स नॉट वेरी न्यू, के सरा सरा इज ऑल्सो अ 90s सॉन्ग, बट you remember that song Ke Sara Sara, that is also based on that. Again there was another song, घर से निकलते ही कुछ दूर चलते ही रास्ते में है उसका घर. That is Yaman. So I will just start the उसका आरोह अवरोह and पकड़ and आलाप I will tell you. ठीक है. So just let me know somebody from the audience if there is any difficulty in hearing. I will adjust. Re ga ma dha ni sa sa ni dha pa ma ga re sa re ga ma dha ni sa sa ni dha pa ma ga re sa. ये आरोह अवरोह हो गया. इसकी पकड़ ये है रे गा पा मा गा रे सा. नाउ इसके आलाप है नि रे सा आ ni re ga re ga re ma ga re ni sa ni re sa. Re ga ma pa ma dha ni dha pa ma dha ni dha pa pa ma re ga re ga ma pa re sa re sa. Ma ga ni ma ga ma dha ni ga ma dha ni ma ga ma dha ni dha ni sa dha ni sa dha ni sa pa ni dha pa ni dha pa re ga re sa re ga re sa re ga re sa ni ni re sa I always advise my patients to use a earphone. We give them earphones also, if it is possible with us, and otherwise we'll tell them to get it. The reason, and I tell, see, generally we start our mantras, then yoga, everything. At the end of our session, our team is of 6 people. So at the end of the session, I take over again, and that time I tell the patients to close their eyes and put earphones and listen, because or there should be seclusion, shanti chahiye, and then they should absorb all the effect of the surs which I am playing. I don't know how many people have heard this with the earphones on, but the thing is, after listening to Yaman, no, you feel happy. वो जो लास्ट है ना रे ग रे सा, you feel like smiling while singing that रे ग रे सा, तो वो जो effect है that comes very efficiently, and it can be seen on the, and of course first we see it on the mothers feel very happy after the music session. Now I'll go, if I have time, ma'am. I have time, then I will play indoor. And please, the organizers, tell me when I have to stop.
Ma'am, actually you can extend for more 5 minutes.
Okay, then हिंडोल play करके मैं बंद करती हूँ, ठीक है?
Okay, ma'am.
It's okay?
Yes, ma'am.
Thank you. So हिंडोल जैसे मैंने बोला फर्स्ट ट्राइमेस्टर में हम प्ले करते हैं. That is Sagani Madha Gama Gasa Sagama Sa. उसके आप है This is indoor, and I'll end my lecture here because there is another lecture, but I will definitely like to answer if any queries are there, and if anyone is interested, I will give my sir's number. And thank you once again, the organizers, for giving me this opportunity. Love being a part of this webinar. Thank you so much.
Thank you so much, ma'am. But this music and your voice was so pleasing that we would like to hear more of these ragas. Please,
Thank you, ma'am. Yes.
Ma'am, I would request, if possible, can you please make us listen more of these ragas in your sweet voice? Now.
Pardon?
Can you?
Yes, ma'am.
Can you please sing more of these ragas for us, ma'am?
Oh, sure. No problem. 1 minute. There is one more, मियाँ मल्हार. अभी वो सीजन जो है इसका, तो उसका ये बेस ऐसा है. अरे मारे रे पा मारे नी प नी सा सारे माँ पानी पमरे सारे माँ पानी पमरे रे पमरे नी प सा. And the song based on this is बोल रे पपी हरा बोल रे पपी हरा एक मन तर से एक मन प्यासा एक मन प्यासा एक मन तर से बोल रे पपी हरा बोल रे पपी हरा बोल रे पपी हरा. Thank you, ma'am.
Thank you so much, ma'am. Thank you, mom, for enlightening us with this concealed science of music. I'm sure this session has added a lot to the knowledge of practicing as well as budding obstetricians who are planning for a Garba Sanskar unit in future. And sorry I couldn't present, but I must say, ma'am, you have got a melodious voice.
Thank you.
So moving forward, we will move forward to our second session now. I would request Dr. Baljot Kaur ma'am to please enlighten us with the topic endometriosis and Ayurveda and an overview. So to introduce ma'am, I would like to mention that ma'am is professor in the Department of Prasutitantra and Striroga at Shahid Kartar Singh Sarabha Ayurvedic Medical College and Hospital, Sarabha, Ludhiana, Punjab. Ma'am has 20 years of clinical experience, including 12 years of teaching experience. Ma'am has also worked in government sector for short time. Ma'am has been guest speaker in various radio and television talk shows and webinars. Ma'am has presented papers in various national and international conferences and published various articles in journals, magazines, and online platforms. Ma'am has also contributed chapters in 2 books, namely Ethnobotany of Plant Contraceptives in the book Ethnobotany of India, Volume 5. The chapter is about different plants used as contraceptives in various forms. Second chapter is Varti Kalpana with special reference to gynecological disorders in the book Therapeutics in Gynecology. Ma'am is on editorial board of International Ayurvedic Medicine Journal. I would request ma'am to please start with the lecture.
Namaskar. Thank you so much. I thank NIA and mainly Bharti ma'am and all the organizing members of the organizing committee to invite me and giving this opportunity to share my views on endometriosis. And I pay my regards to Chief Patron Shri Sarpananda Sonowal, Patron Vaidya Rajesh Koteja sir, Organizing Chairman Professor Sanjeev Sharma sir, Vice Chancellor, and Pro VC Ved Meeta Koteja madam. I bow my head in front of Lord Dhanvantri for giving us this knowledge, and I'm sharing my screen. Just a minute. Is it visible?
Yes, ma'am.
Okay, today I will be discussing about endometriosis and Ayurveda and overview. So coming to endometriosis, it is a disease that affects many women predominantly during the reproductive period of life. With the cardinal symptoms such as pelvic pain, bleeding disorders, and infertility, the disease has a tremendous impact on women's well-being and health. In the most of the women affected, the first symptoms can be traced back to adolescence. Types of endometriosis. Three forms of endometriosis are classified according to their location, mainly ovarian endometrioma, superficial peritoneal lesions, and deep subperitoneal infiltrating endometriosis. The most common locations for the ectopic endometrial implants are the ovaries, the fossa ovarica, the uterosacral ligaments, the posterior cul-de-sac, the rectum and the sigmoid, and more rarely in the pericardium, pleura, and even in the brain. Now, for that, we have to understand the menstruation. Historically, menstruation has been associated with ischemic necrosis of the functional layer of endometrium caused by the contraction of the spiral arteries, with the process being dependent on sex hormone concentration. On days 2 to 3 of the menstrual cycle, the endometrium is rapidly covered within 48 hours by surface epithelia that originate from two major sources, namely the exposed stump of basal glands and the remaining surface epithelium bordering the denuded area. Progenitor cells in the endometrium respond to hormonal changes and regenerate the endometrium and vasculature in each menstrual cycle and support stromal decidualization during embryo implantation. So here we have to, in endometriosis, this basal layer has a significant role, and we can see the endometrium has two parts, functional zone and basal zone, and mainly functional zone undergoes changes with monthly cycle, and basal zone, it has terminal ends of glands, and it remains constant, so we can understand the difference between Arthav and Raja here. Now, the basal layer has been considered as the place where stem or progenitor cells reside and contribute to the construction of functional layers. The disease process starts focally in the depth of the basal endometrium. Now, Decker et al. Found the menstrual flow of women with this disease was composed of significantly more endometrial tissue shed from the basal layer, which is considered the residing site of endometrial stem cells. The basal endometrium in women with endometriosis is twice as thick as in healthy women. Moreover, while in healthy women the endometrial myometrial lining is smooth and regular, it is irregular and sometimes polypoid in affected women. So there is the syndrome of dislocated basal endometrium, a term that comprises the pathophysiological continuum of endometriosis, endometriosis in association with adenomyosis and perimenopause adenomyosis, thus appears to be a very common phenomenon. Here I will be mainly focusing on the pathophysiology of endometriosis. What are the main causes that endometriosis occurs? So its cause or causes may be closely related to the physiological process of reproduction. Trauma followed by tissue-specific hyperreactive inflammatory response and repair involving specific albeit physiological, cellular, biochemical and molecular mechanisms may be considered the major events in the development of the disease. So factors involved in pathophysiology, these are the main factors: reflux or retrograde menstruation, utopic endometrium, tissue injury and repair, apoptosis, cellular and humoral immunity, angiogenesis, epidermal growth factor, hormones mainly estrogen, progesterone and aromatase, nerve fibers, interleukin-8, macrophages, integrins, and stem cells. So we will be discussing in short about all of these. Now, reflux retrograde, that is retrograde menstruation. So, under normal conditions, cells that do not adhere to their extracellular matrix enter apoptosis as they receive different signals from their adhesion receptors. So, however, in women with endometriosis, these cells have the ability to adhere to mesothelial cells of peritoneum, to proliferate, and to produce neoangiogenesis, resulting in the development of active endometriosis. Reflux menstruation or reflux or retrograde menstruation, Reflux of endometrial fragments during menstruation into the peritoneal cavity is a common phenomenon. Fragments of basal endometrium were found in the menstrual effluent with a higher prevalence in women with endometriosis than in controls. So, on the basis of these and other findings, it was suggested that pelvic endometriosis results from the transtubal dislocation of fragments of basal endometrium. In this respect, the significance of menstruation in the disease process should be more precisely defined. So, during menstruation, the basal endometrium is maximally exposed. This facilitates both the detachment of fragments of basal endometrium and their upward transport in the presence of hyperperistalsis, and this we can correlate with the Raja Upadhatu and Udavartini Yoni Vyapad, which we will discuss later on. Then pelvic endometriosis has been described in adolescent girls also prior to menarche. And coelomic metaplasia has been suggested as the underlying mechanism. And nowadays, we do find if a girl is complaining of pain in abdomen, then we have to consider endometriosis also. And we are finding endometriosis in premenarchal girls. Large antral follicles are observed in the ovaries of premenarcheal girls that might stimulate uterine peristalsis. Thus, detachment and upward transport of fragments of basal endometrium from the more or less unstimulated endometrium in these girls has to be considered as well. So, this hyperperistalsis is also one of the cause. Then utopic endometrium. There are fundamental abnormal changes within the utopic endometrium of women with endometriosis compared to normal endometrium of women without endometriosis. So, utopic endometrium shows enhanced ability of proliferation, implantation, angiogenesis, and greater probability of escaping the unfavorable conditions of the ectopic environment. Therefore, the character of utopic endometrium determines the fate of the backward flowing endometrial tissue to live or to die. So, the pelvic environment is the key and significant in the cause of endometriosis. The abnormal endometrial tissue in endometriosis patients flows backwards to pelvic cavity, completing a three-step procedure of pathogenesis called 3A's: attachment, aggression, and angiogenesis. So, endometriosis is established when retrograde endometrial cells engraft within the mesothelium and pelvic cavity. So, before the progression into peritoneal endometriosis, the effluent viable endometrial cells must, what are the factors? They evade the immune attack within the pelvic cavity, attach to the peritoneum and other pelvic organs by the forefront step of adhesion, then subsequently break through the extracellular matrix and basement membrane, and ultimately implant at an ectopic location and develop characterized by neovascular system formation. So all these factors play a significant role. Then tissue injury and repair. It became evident that the non-pregnant uterus is constantly active throughout the reproductive period of life and thereby is rather inevitably subjected to mechanical strain. So with uterine peristalsis and directed, that is sperm transport, a novel uterine function has been discovered. Moreover, it became apparent that the molecular mechanisms associated with mechanical strain, injury, and repair displays a pattern that is quite similar in different tissues and involves the expression of P450 aromatase and local production of estrogen. So, hyperestrogenism is also a major factor. Hyperperistalsis and increased intrauterine pressure would, with time, result in myometrial dehiscences that are infiltrated by basal endometrium with the secondary development of peristromal muscular tissue. So early lesions usually present close to the fundocornual raphe of the arc myometrium. So in any event, repeated and sustained overstretching and injury of myocytes and fibroblasts at the endometrial myometrial interface close to the fundocorneal raphe would activate the TR system focally with increased local production of estradiol. This process starts on a microscopic level. So there is injury and then estradiol aggravates that. So this is the diagrammatical representation. So this is the initial focus of injury, and then augmented by injury by hyperperistalsis, and then all the prostaglandins and the angiogenesis proliferation and estradiol role is there. Then apoptosis. Apoptosis is a programmed cell death with characteristic morphological and biochemical changes without an inflammatory response. So this is the natural process of endometrial cells to die, but in this case, this does not happen. So impaired sensitivity of endometrial tissue to spontaneous apoptosis contributes to this abnormal implantation and growth of endometrium at ectopic sites. The inability of endometrial cells to transmit a death signal or their ability to avoid cell death is associated with increased expression of anti-apoptotic factors, that is BCL2, and decreased expression of pre-apoptotic factors, for example, BX. Then cellular and humoral immunity. One important aspect of the physiology of endometriosis is defective immune surveillance. The disease is secondary to abnormalities of the cellular and humoral immunity that induce excessive receptivity of the peritoneal mesothelium, hyperactivated macrophages, and abnormalities of NK cells. It is also possible that an excess of refluxing endometrium or altered endometrium has the potential to form a pro-inflammatory or hormonal environment favorable to establish the disease. Then angiogenesis and epidermal growth factor. There is much evidence indicating that the human endometrium itself is highly angiogenic, which might contribute to the initiation of endometriosis. So among the identified angiogenic factors, vascular endothelial growth factor is the most potent and studied factor in endometriosis. Then Donnes et al. Reported that utopic endothelium of women with endometriosis as compared to endometrium from healthy women exhibited significantly increased VEGF levels, particularly during the late secretory phase of the menstrual cycle. So that is why we have come across the PMS. Then epidermal growth factor plays fundamental roles in diverse processes such as embryogenesis, development, proliferation, and differentiation. Recently, research indicates that it also has an angiogenic activity. The Egf system consists of 4 receptors, that is human epidermal growth factor, a receptor, that is HER1, 1,4. It has been shown that EGF and its receptor HER1 are expressed in normal endometrium. Then hormones, 17-beta-estradiol E2 is the key hormone for the growth and persistence of endometriotic tissue, as well as the inflammation and pain associated with it. Then estradiol reaches endometrium by circulation, but it is mainly produced locally in the endometriotic tissue. This local estrogen accumulation has been considered to play an important role in the development and progression of endometriotic lesions by binding and activating the endometrial receptors. Then endometriotic tissues have the ability to synthesize E2 de novo from cholesterol because there is a high expression of two of the most important enzymes involved in the process of estrogen biosynthesis, that is aromatase CYP191A and steroidogenic acute regulatory protein. In contrast to endometriotic lesions, normal endometrium does not have the ability to synthesize estrogen due to the absence of these enzymes. The nerve fibers have been identified within the functional layer of endometrium and in increased concentration within the myometrium of women with endometriosis. So, women with endometriosis and pain symptoms have significantly higher nerve fiber density in comparison with women with infertility but no pain. This finding indicates that the nerve fibers in endometriotic plaques and may originate from nerve fiber progenitors in the functional layer of the endometrium, which probably provides a mechanism for lesion-specific pain in endometriosis. So this is the difference. Here is the functional layer and the basal layer. So nerve fibers are mainly in the functional layer. It is also speculated that primary abnormalities in in utopic endometrium of patients have a role not only in the genesis of endometriosis but also in the genesis of symptoms. Then interleukin 8, it is a chemokine for neutrophils and a potent angiogenic agent and is elevated in the peritoneal fluid of women with endometriosis. IL-8 promotes proliferation of stromal cells derived from endometriotic tissues, suggesting that it may facilitate growth of endometriotic implants. Now, macrophages, the peritoneal cavity, the commonest site of endometriosis, contains fluid whose major cellular constituents are macrophages. In endometriosis, the number and the secretory activity of these cells increase. The function of macrophages is also altered in several aspects. The diminution of cytotoxicity of peritoneal macrophages could be more significant than that of circulating macrophages. The reduced capacity of peritoneal macrophages from women with endometriosis to mediate lysis of endometrial cells, together with the increased resistance of ectopic endometrial cells to macrophage-mediated cytolysis, may promote survival of endometrial cells in the peritoneal cavity of women with endometriosis. The integrins, they are proteins known to mediate adhesion of cells to either neighboring cells or to extracellular matrix, and they play an important role in this adhesion process. Now, recently, increased integrin expression has been observed in utopic endometrium of women with endometriosis compared with control endometrium. Furthermore, the expression of integrins in both mesothelial and in menstrual effluent has been demonstrated in women with endometriosis. In stem cells, Gotten et al. Found increased expression of the adult stem cell marker Musashi-1 in utopic endometrium of patients with endometriosis, which favors the stem cell origin of endometriosis. Then furthermore, endometrial stem cells could regenerate not only endometrial and stromal cells, but also endothelial cells and form mature blood vessels. The predominant hypothesis proposes that ectopic endometriotic lesions might originate from utopic endometrial stem cells, which probably abnormally shed from their location in the basal layer of utopic endometrium from the women with endometriosis, but is not seen in women without this disease. So this is the pathophysiology. This is the retrograde menstruation, then this is the endometriotic lesion, and these are the hormones and the macrophages and the TNF factors, their role in causing endometriosis. Now, sign and symptoms. This detail is given by Foxy. Endometriosis can be suspected in women, including young women aged less than and equal to 17 years, presenting with one or more of the following 7 Ds, that is dysmenorrhea, dyspareunia, dysuria, dysthesia, dysfunctional uterine bleeding, difficulty in conception, and diffuse abdominal pain. So these 7 Ds should be taken into consideration. So the risk of developing endometriosis depends on a complex interaction between genetic, immunological, hormonal, and environmental factors. It is largely considered to arise due to a dysfunction of immunological surveillance. In fact, women with endometriosis exhibit altered functions of peritoneal macrophages, lymphocytes, and natural killer cells, as well as of inflammatory mediators and growth factors in the peritoneal fluid. So these factors we have to consider when we are treating the endometriotic patient. So coming to the Ayurvedic overview. So before moving to Ayurvedic understanding of endometriosis, first we have to understand what is Raja and what is Artav. So these two main terms have been described for menstruation and menstrual cycle. Now coming to Raja, it is the Updhatu of Rasthatu. Acharya Sushrut illustrates the formation of Raja while explaining the details about Shonit, that is Raktadhatu. Rasat ev striya raktam Raja sangyam pravartate. Poshak ras or ahar, when reaches the origin of Raktava Srotas in Yakrit, where it is acted upon by Ranjak Pet or Agni, metamorphoses to Raktadhatu. So when a part of this Rakt comes to the uterus, it is termed as Raja. Acharya Dhalan explains that the Rakt which comes out of uterus during Ritukal is termed as Raja. Then Vikaro Dhatu Vaishamyam, Dhatvo Vatadayo, Rasadayascha, Tatha Rajah, Prabhritiyascha, Tesham Vaishamyam. So Raja has the capability of getting vitiated. So Raja Upadhatu can be considered as basal layer of endometrium which is stable. The Upadhatu is said to be Gati Vivarjit. Now, Arthav word implies whatever is cyclical, that is Ritobhavam Arthavam. Tikakar Indu has explained that all the processes involved in the Pravartamanam are to be considered as Arthav. Arthav which accumulates over Rajo Upadhatu can be considered as functional layer of endometrium. Coming to Rakta, Sira is Upadhatu of Rakta Dhatu. Sira refers to the vascular structures in the body that perform the function of transport, circulation, transmission of bodily elements. The root term Sru, from which the word Sira is derived, indicates flow. So endometrium formation, Masen Uchitam Kale, Dhamnibhyam Tat Artavam, Ishat Krishnam Vivarnam, Cha Vayu Yonihi Mukham Neyat. So, Tikakar Vishwamitra has said Sukshmakesha Pratikasha Bij Raktavah Siraha Garbhashayam Tarpayanti Masad Bijaya Kalpate. So he has clarified that hair thin vessels fill the uterus for whole month to receive the beach, both Stri and Pum beach. Then Apanvat, it's mainly its sthan and karma is Vrishnav Basti Medram Cha Nabhya Uru Vankshnav Gudam Apan Sthanam Andrastha Shukra Mutrash Chakrinti Cha Srijti Artava Garbhav Cha Yuktah Sthan Sthitischa Te Tva Karma Kurvate Deho Dharyat Neran Ameyaha. So main sthan of Apan Vayu is Artav or Garbh Nishkraman, and when it is doing its proper function, then it is maintaining the body, otherwise it is causing diseases. Apano apangah shroni vasti medro cha gocharaha shukra artav shakrit mutra garbh nishkraman kriyaha. So artav nishkraman, garbh nishkraman is its function. Then apan vatve gunya विमार्गस्थ ही अयुक्त व रोगे स्वस्थान कर्मज है शरीरम पीड़ियाते येते प्राण अनाशु हरंती च. So here vimargastha is abnormal pathway. Then the normal pathway of Apan Vayu is downward movement, but when it is not flowing in downward downward in a proper way, then it is vimargastha and ayukta is vitiated. So this will cause gynecological disorders in this context. So endometriosis in Ayurveda. So there is no direct reference of endometriosis. It can be compared as a syndrome complex. Yoni Vyapad having pathophysiology similar to as in the endometriosis can be Udavartini Yoni Vyapad, Paripluta Yoni Vyapad and Vatla Yoni Vyapad. So we'll look into a bit of on Udavartini Yoni Vyapad. So Vega Udavartanat Yoni Udavartayate Anilaha Sa Rugarta Raja Krichrain Udavrittam Vimunchati. So Artave Sa Vimukte Tu Tatshanam Labte Sukham Gamanat Urdhavam Geyo Udavartini Buddha. So Yoni Udavartayate iti Yonim Udavarta Vatam Karoti. So Udavrittam iti Urdhva Nitam. So here the downward flow, here it is said that Krichrain Udavrittam, that it is with the difficulty that that Artha flows downwards. So then as it is released, as it starts flowing down, then pain is relieved. So Vikarin Rajasa Urdhava Gamanat Urdhavartini iti Uchyate. So Chakrapani has that Vikarin Rajas Urdhva Gamanat, going upward. So here we can correlate it with the reflux or the retrograde menstruation. Then Paripluta Yoni Vyapad Pittalaya Nari Samvase Kshavathu Udgar Dharanat Pitta Yuktain Maruta Yonihi Bhavati Dushitaha Shunaha Sparsha Asaha Sa Arti Neela Pita Asravahini Basti Kukshi Gurutva Atisar Arochak Karini. Shroni Vangshan Ruktod Jwar Kritsa Paripluta. So here mainly Pit Prakriti female and its main symptoms are Shuna, Sparsha Hasayata, then Arti is there, then Basti Kukshi Gurutva, Atisar is there, Arochak is there. So these are the main complaints or the symptoms which we generally find in the patients with dysmenorrhea or endometriosis. Then fever is there, low grade fever, patient complains about it. And here the studies have also found that bacterial infection is also one of the factors for endometriosis. And it has been found in the menstrual blood that bacterial, especially E. coli, are present, and that they can cause, that can lead to endometriosis. Then परिप्लुतायामित परिसर्वतो वाता विकारिन प्लुत्वत परिप्लुता संज्ञः. So pain whole around the pelvic region. परिप्लुतायाम बाह्य अभ्यंतर वाता वेदना भी युक्तायाम. And gramya dharmen ruk bhrisham. So here gramya dharmen has been described, and nowadays it can be considered like teenage sex is on rise, and I have seen patients with endometriosis, adenomyosis, which gives the history that even if the patient is married or they had love marriage, like before marriage they had very frequent coitus, and then they used to have emergency contraceptives, or otherwise also taking contraceptive pills to avoid pregnancy. And this after that regular use of irregular contraceptive methods, this leads to endometriosis. And Vatla Yoni Vyapat, as we all know, Vatalahara Cheshtayah Vatlaya Samiranah Vivridho Yoni Ashritya Yonestodam Savedanam Stambham Pipilika Sruptimiv Karkashtam Tatha Karoti Suptim Ayasam Vatajancha Aparan Gadan Sa Syat Sa Shabd Ruk Fein Tanu Ruksh Ardav Anila. So this is the typical symptoms of Vat, which we can find in the patients having endometriosis of grade 2, 3 and 4. So this is my understanding that in the early stage we can consider Udavartini Yoni Vyapat and Paripluta Yoni Vyapat, and in the later stages Vatla Yoni Vyapat. Then what Nidan? It is said Vinchati Vyapado Yonir Jayante Dushta Bhojanat Vishmasthang Shayan Brish Methun Sevnah Dusht Artavat Uptravya Bija Dushin Devatah. So here Dusht Bhojanahar, we know Dushi Vish, dioxins, xenoestrogens, and all the junk food and the soft drinks females are taking, that leads to Dushit Ras, and that leads to Uttarotar Dhatu Kshinta. Now, Vishamangshayan, abnormal posture of the body, it causes congestion in the pelvic region. Coitus, it leads to intake of hormonal pills, as I've described earlier. Dushtartha, that is endometrial or menstrual disorders. Beechdosh, abnormality during intrauterine life. And as we have seen in the adolescents, that antral follicles are bigger in size, and they secrete more of estrogens. In management through Ayurveda, Nidan Parivarjan, Rajaswala Paricharya, Shaman Chikitsa and Shodhan Chikitsa. Now coming to Rajaswala Paricharya, this is very important to follow, and here lies the health of the female. So Tatah Pushpadarshane Pratham Divasat Prabhriti Brahmacharini Snanyad Alankar Rahit Darbha Sanskar Shaini Triratram Asit. So they have said that with the starting of the menstrual cycle, for 3 days she has to live a life of brahmacharya, like she has to be in a very calm and quiet place. She should not decorate herself. You do not use ornaments, because any kind of anxiety is not good for her. Then she should sleep on darb shayya, because that is darb has been said to be good antiseptic. And पर्ण शराव कर्तल अन्यतमे च यावकं पयस सिद्धम अल्पम कर्षणार्थम अश्नियात तीक्ष्ण उष्ण अम्ल लवणानि वर्जयेत. So तीक्ष्ण उष्ण अम्ल or lavan, they are not to be taken. Then food should be taken in parn or the leaf plate, sharav or that is the जो भी मिट्टी के बर्तन बन रहे हैं या हाथ में लेके खाना, उसको खाना है, because it basically the pH level is balanced when we eat food in these utensils. Then you have to take the payas of yav or with the shali chawal, and that is to be taken in smaller quantities, and it is helpful in karshanartham, in karshan of the body. Now, kshairayam yavakam stokam koshta shodhan karshanam. So, in Ashtanga Hridaya, it is said it is to be yav to be cooked in milk with little ghee, and it has to be taken in small quantities, because at this time the digestive fire is very slow, so we have to make it so that this food is also digested properly. Then karta sharav pan anyatame bhojnim havishyam. So havishyam sagrit shalya odani kshir sanskritam yavanam iti eke. That is, Dalhan has said that it is to be taken in smaller quantities. So karshan helps to maintain vaishadya of artav and timely cessation of bleeding. So Raja Kala is natural Shodhan Kal leading to Agnimandya. So aim of Rajaswala Paricharya is to avoid vitiation of Vata and Kapha, prevent formation of arm and restore energy. So during menstruation, regeneration of endometrium starts even before menstruation ceases and is completed 2 to 3 days after the end of menstruation. New blood cells grow from the stumps of old one. The glands and stromal cells are regenerated from the remnants left in the basal zone. The regeneration of functional layer is attributed to a unique stem cell population and its progenitor cells confined to basalis layer. So that is why Rajaswala Paricharya is so important, and they have, Acharyas have mentioned 3 days. So here we can easily understand that why these 3 days are important. Then coming to Shaman Chikitsa, first is the Chikitsa Sutra, then Langhan, Deepan Pachan, Udavartini Yoni Vyapa Chikitsa, Rakta Prasadan Chikitsa, Rushi Vishar Chikitsa, Shofar Chikitsa can be done. So, Chikitsa Sutra is Nahi Vatatrite Yoni Narinam Sampradushyate, Shamayitva Tamnasya, Kuryat Doshasya Bheshajam. So first is Langhan, Deepan and Pachan, and so whenever a patient of endometriosis comes to me, first of all is the Langhan, and that too Langhan with I advise moong dal or yavagu and chatutansh jal, that is boiled to 1/4 part, and Dhanyak Shunthi Kwat. Then Deepan Pachan is done. Then coming to Udavartini Yoni Vyapa, first mainly Anuloman, because we have to take care of Apanvayu. So Avipatikar Churna, Hingwashtak Churna, Eranbrisht Haritiki can be given. Along with this, and in this slide and further slides, I will be just mentioning the various medicines which we can use, because Purusham Viksha, every patient is an individual where we have to make the medicine or give the medicines according to the prakriti of the patient and severity of the disease. So among all these medicines we can formulate the prescription. Sukumar Kashaya, Sahacharadi Kashaya, Dashmul Kwat, Dashmul Devdaru Kwat, Varunadi Kwat, then Sehnath Google, Raspachak Yog, Gokshuradi Google, Chandraprabhavati, these can be given. Then Rakta Prasadan Chikitsa, Rakta Pachak Yog, Keshor Google, Sud Shekhar Ras, Giloy Ghanvati, Then Yashti Madhu, Sariva, Khadir, these can be given in various combinations. Sarivadi Asav, Trayantyadi Kashaya, Mahatiktam Ghritam can be given. Then Dushivishar Chikitsa, since Dushivish cannot be metabolized and only detoxified by shaman with Tiktaras Pradhan Dravyas, so Dushivishari Gulika, Bilvadi Gulika, Gulgulutiktam Kashayam, Manjishtadi Kashayam, and Mahatikta Ghrit, these can be given. And Shofar Chikitsa, Punanavadi Gugulu, Punanavadi Mandur, Dashmulkwat, Trayantyadi Kashaya can be given. Then coming to Shodhan Chikitsa, Virechan, Basti, mainly Yog Basti and Matra Basti and Yoni Pichu. So Virechan plays a very significant role, and one sitting of Virechan can give very good results, and Basti is the mainstay of Vat Chikitsa, and Yoni Pichu, it also helps at the local level. Now, I'll be sharing two researches. There are many work is going on endometriosis in various institutes and at the individual level, and we are getting very good results in endometriosis. So this was one study, a case study on successful Ayurvedic management of chocolate or endometriotic cyst by Dr. Mangesh Patil. And in this 34-year-old female patient with complaints of pain in left iliac region, generalized weakness and giddiness during menses, irregular menses, and then she was taking hormonal pills for 1 year. And this was the treatment. It was given for 11 months. So at the start of the treatment, the Panchkarma was given with Anuvasan with Sahacharadi tail and Niru with the Shmulkwat. Capsule Ovased, Raspachak Vati, Suchekhar Ras, Panchadhrit was given. And then Kanchana Kuglu, and this is the various other treatments that was given to her. And this was her last USG was done, where polycystic changes seen in the ovary, and there was no endometriotic cyst. Then this is the case 2, role of Guduchyadi Vati and Guduchyadi Tel Uttarvasti in Vata Joni Vyapat by Dr. Minakshi Pathak. It was done in BHU. And here her study was clinical study and experimental study. There were 3 groups were made, one with oral Guduchyadi Vati, other with Guduchyadi Tel Uttarvasti, and third with both the treatment modality. And in experimental study, endometrial biopsy was taken, and prostaglandins, assessment of prostaglandins to histology and immunohistochemistry with COX-2 antibody of human endometrium was done. So, and the selection of cases was group 1, they were given Guduchyadi Vati 500 milligram, 2 tablets twice a day for 2 months. In group 2, Guduchyadi Tel Uttarvasti in 3 sittings after menses for 2 months. And in group 3, Guduchyadi Vati and Guduchyadi Tel Uttarvasti was given. So, and the results were the combination of oral and Uttarvasti of trial drug is most effective in treating Vata Joni Vyapat. Histology of human endometrium revealed that after treatment, inflammatory markers reduced with maximum effect seen in group 3, then group 2, followed by group 1. COX-2 expression, brown precipitating glandular epithelium, which we'll see in the next slides, also decreased in patients treated with Uttarvasti and combination of oral and Uttarvasti. There was no effect on endometrium of patients group 1. This signifies that oral drug gave only symptomatic relief in Vata Joni Vyapat. So these are the histological pictures of oral Guduchyadi Vati before treatment and after treatment. So acute phase of inflammation has been reduced in the after treatment. So these inflammatory markers are found reduced in treated patients as evidenced by figure 2. The endometrium in both figures appeared clumsy and irregular in pattern. Then this is Guduchyadi Tel intrauterine instillation. The inflammatory markers are reduced in treated patients as evidenced in figure 4 in comparison to figure 3. The pattern of endometrium appears somewhat regular in figure 4. Then this is oral Guduchyadi Vati and intrauterine instillation of Guduchyadi Tel. There are enormous inflammatory markers in before treatment figure. These inflammatory markers are significantly reduced in after treatment picture with Guruchadi Vati and Tel Uttarvasti. The pattern of endometrium after treatment appears regular like histology of a normal endometrium. So there are many more studies, researches are going on, and we get very good results in endometriosis. And I have even seen the patients of frozen pelvis which have come to normal with Ayurvedic treatment. Modern medicine mostly prescribes treatments that may offer fast relief for endometriosis symptoms, but it does not eliminate the root cause of this disorder. Endometriosis is a faceted disease that affects the quality of life of millions of women and their families worldwide. Its diagnosis is complex. But with Ayurvedic management, we can reverse the pathophysiology of endometriosis, and treatment must be individualized and taken into consideration the impact of the condition on the quality of life. Thank you.
Thank you so much, ma'am, for such informative session. I would request Dr. Anu sir to please give the closing notes.
Thank you, Rogina. Am I audible?
Yes, sir.
It's been an honor to be present in this webinar and to deliver the closing remarks. I would like to express my deepest gratitude and appreciation to both speakers, Dr. Seema Mehra Madam and Dr. Baljot Kaur Madam, for their valuable contribution to the webinar. First guest lecture, which was given by Dr. Seema Mehra Madam on the topic Raga, music therapy during pregnancy, are very interesting. Madam has explained the importance of music and ragas for achieving a Shreyasi Praja. Madam have also detailed explanation about how ragas can be used as a part of Garba Samskara, how ragas can be selected, and from the presentation, I can understand that ragas should be selected Purisham Vishya, that it should be selected according to the month and mood of the patient. Madam also explained about the Swaramrut Grantha and the connection of Swaras with the Tridosha. Once again, we are expressing the deepest gratitude to Madam and remembering the god of music, Lord Tamburu, with the folded hands. The second lecture was given by Dr. Baljot Kaur Madam on the topic Endometriosis and Ayurveda, an overview. Madam, I would have to say you have compiled and included the most recent updates regarding the pathogenesis of endometriosis, concept and pathogenesis of endometriosis in Ayurveda, and given a detailed case discussion, which was very interesting. So I would like to express my deepest gratitude to Madam also. Once again, we, the Department of PTSR, are with the folded hands to both the speakers. We are expressing our sincere gratitude. Thank you.
Thank you, sir. Now, I would request Dr. Poonam Chaudhary, ma'am, to please give the vote of thanks.
Good afternoon, everyone present here. I, Dr. Poonam Chaudhary, on behalf of the Department of Prasutitantra and Striroga and IIT Jaipur, is very much thankful to our Chief Patron, Sri Sorvanand Sonwal sir, Honorable Cabinet Minister of Ayush, Patron Rajesh Kotecha sir, Secretary Ministry of Ayush, our beloved respected VC Professor Sanjeev Sharma sir, our respected Pro VC Meeta Kotecha ma'am, Registrar, all the deans, HODs and faculty members. I extend my gratitude to our speaker, Dr. Seema Mehra Madam, to take out time from her busy schedule and for sharing knowledge. And your words enlightened us, ma'am, and I am sure this will enhance our clinical wisdom in Garba Sanskar. Next, I would like to thank Dr. Baljot ma'am for the elaborated clinical experience sharing about endometriosis. Thank you so much, ma'am. A special thanks for our Pro VC Meeta Kotecha ma'am for her inspiring mentorship and ever helping nature. I am very much thankful to our organizing secretary, Professor Bharti ma'am, for providing immense support to make the webinar successful. I must thanks to our organizing team members, Professor B. Pushpalata ma'am, Dr. Hetal Dave ma'am, Dr. Sonu ma'am, Dr. Jyotsna ma'am, and Dr. Anu MS sir to make this webinar successful. Next, I would like to thank IT expert team for the technical support. Last but not the least, I would like to thank and express my gratitude to all my dear students, esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. Thank you everyone once again for making it a great success. Thank you everyone.
Thank you so much for this for attending this webinar peacefully and your peaceful listening. Now I announce that this webinar is completed and we may disperse. Thank you all.
Thank you so much.